Today's healthcare environment is continuously looking for solutions that deliver efficiencies and help restrain the growth in medical cost while still delivering consistent, high-quality care. Sanford Health, a nonprofit healthcare facility with multiple locations, faced these challenges head-on in the design and implementation of their patient-centric clinic in Moorhead, Minnesota. Sanford's aim was to launch a new medical center that would accelerate access to care for patients by creating a more efficient clinic and more collaborative clinical teams to ensure patients would no longer sit in a waiting or examination room for long periods of time without a caregiver, but would instead flow through the facility quickly and efficiently. To help them achieve this, JLG Architects designed and built a facility that integrated Sonitor Technologies' unique ultrasound Sonitor Sense RTLS solutions and Intelligent InSites open healthcare software platform.
The darker blue bars are the self-rooming patients. And so what you're seeing here is they're spending more time with the nurse. Their overall cycle time or their overall treatment time is less.
To optimize and accelerate patient flow and throughput, JLG Architects designed the facility so that Sanford can easily monitor events associated with patients and staff. With the accuracy and reliability of Sonitor Sense RTLS and the automation and integration of Intelligent InSites software, Sanford can easily monitor and track patient events based on staff and patient location data. This ultimately lets them find ways to better predict workflow, improve patient satisfaction, and catch any delays in real time based on RTLS data.
Our use of tags is to help us predict workflow. It's to help add control in an area of variation. It's to let people know when the next patient is in the room. It's not guesswork. How are we going to move patients through our building in a nice, efficient, planned manner without interruptions and delays?
At Sanford, when a patient arrives at the clinic, they are given a Sonitor Sense Smart Tag. They keep this tag with them throughout their visit and are instructed to report to an assigned room so that they can self-room. This allows them to skip the waiting room entirely. As they move through the facility, their tag receives ultrasound signals from the Sonitor Sense location transmitters, which is then captured and displayed in the Intelligent InSites software. By delivering accurate indoor positioning data, time spent searching for patients can be reduced, allowing more time for patient care and other patient-focused activities. Sonitor's smart tags provide location data every 1 to 3 seconds and is displayed through the Intelligent InSites software solution so a caregiver can know exactly when a patient has arrived and is in the examination room. That information is shared via text or email to the appropriate caregiver so that they know exactly when to enter the exam room and can optimize their time and schedule. This can help move patients through the clinic more efficiently and ensure that staff is being utilized to their fullest. At the end of a patient's visit, the last staff member to attend to that individual retrieves the patient's tag. The smart tags, which are water resistant and can be sterilized, are then cleaned and canceled from the software to be reused by another patient. If the tag is not retrieved at the end of the visit, convenient drop boxes are located at the clinic's exit and patients can easily deposit them there. In addition, the clinic has tagged some of their clinical equipment. This allows Sanford to identify utilization for owned and rented equipment, improve PAR levels across the facility, and reduce costs related to keeping underutilized equipment.
When you're talking about less time for total visit time, you're talking about increased capacity, or at least the opportunity to increase your capacity without having to build additional square footage.
By optimizing patient flow and throughput, Sanford has been able to optimize facility space to ensure they are using it in the most efficient way. As a result of self-rooming, patients are no longer sitting in a waiting room, and Sanford has been able to reduce waiting room chairs from 6.2 to 2.8. Optimizing efficiency, workflow, and capacity can turn into real savings. A savings of 1 minute of a nurse's time per patient per day over the course of a day could open enough minutes of a caregiver's time to add several hundred more patient visits. That could easily translate into 1,000 hours of staff time per year. Seeing just 2 to 5 patients more per day can translate into hundreds of thousands of dollars in more revenue per year. Reducing square footage needs can deliver one-time savings that can be reinvested to help further grow the facility.
It's trying to identify what is the real value that a nurse will get, that a doctor will get, that a patient will get. What's better for them?
Combining Sonitor RTLS and Intelligent InSites software delivered significant value to Sanford by providing patients with accelerated access to care, optimizing and accelerating patient flow and throughput, optimizing and maximizing resource capacity and collaboration, optimizing and maximizing spatial capacity, and improving overall financial outcomes.